Hey guys, Dr. Joel here. Welcome back to PCOS. This is part 2. We're talking about how to heal from your PCOS. Let's do a quick refresher. We talked about Poly-Cystic Ovarian Syndrome. It's a condition with cysts that develop on your ovaries due to different hormonal imbalances and cause hormonal issues. We talked about diagnosing it and the different types of criteria that are needed there. And then obviously we talked about the signs and symptoms primarily revolving around your menstrual health, but the main thing that sets polycystic ovarian syndrome apart from the other hormonal imbalance and hormonal conditions for females is with PCOS, you have that excessive body hair growth and you have the balding, sometimes the thinning of the hair. All other female hormone imbalances and hormonal conditions will have a lot of the same symptoms: irregular periods, heavy bleeding, significant cramping, headaches, irritability, infertility, pain, all those things. But with PCOS, you're going to have more that those male high sex hormones. You're going to have that hair growth all over the body that is abnormal for women. You're going to have some of even the balding and hair thinning. We talked about how there's 4 types of PCOS, but from my experience in the clinic working with multiple PCOS patients and getting amazing results, the thing that really drives this issue is high insulin. That leads to an overproduction of testosterone, and then that leads to the PCOS, the development of cysts on the ovaries. So we talked about the high insulin. We talked about the number of different things that can cause that. Nutrition obviously is one of the big ones, having a higher amount of carbohydrates versus protein, and that balance, which is so important. We talked about inflammation, toxicities. We talked about sedentary lifestyle, all those things that can increase insulin. And that insulin over time can then lead to high testosterone. Now, what's really interesting, we're going to talk about in this video, how do you address the high insulin? How do you address the testosterone? And if you get those things right, what's going to happen is you're going to be able to really start reversing that PCOS. And again, this is a condition just like all other female hormone conditions. You can reverse these, you can balance them out. Having terrible pain and a heavy bleeding and all those things with your period every time is not normal. Always worrying about if you're actually going to get your period, if you're actually going to be able to be fertile and have kids, that's not normal. And those things can be reversed and balanced out. And so I want to give you some simple tips and advice and insights into what I see works best in the day-to-day actually working with patients. And hopefully you can take these things and apply them into your nutrition, lifestyle, all these things, and just be a little bit healthier because of that. So we have high insulin. What causes that high insulin? We talked about the diet high with high carbohydrates to protein ratio. We talked about inflammation, toxicities, high cortisol, which is your main stress hormone. We talked about the sedentary lifestyle. Now, what's interesting is a lot of women with PCOS, they, with high insulin and blood sugar issues, normally people are going to be, normally you're going to be a little overweight. And what's really interesting is some women that I've seen have this high insulin level, and I even have other patients that have high insulin resistance, but they don't have a lot of significant weight gain. Like they look fairly normal. Like it's not someone that you would look at and say wow, they're a little overweight. And so it can be a little bit confusing there. And a lot of times even their nutrition is pretty good. And in those cases, that's where we have to look at chronic inflammation. We have to look at toxicities. We have to look at all these other things that might be driving insulin. That condition, that scenario where the nutrition is good, yet they have these other issues going on, that one's a little bit harder to address because you have to look at testing different things. And in my office, we're primarily using Systems Healthcare, which uses muscle testing and a number of other different neurological reflexes to actually figure out what's driving these issues. And that's where that technique really is amazing at kind of sorting through, okay, what's actually driving this insulin issue and what do we need to address? But for the most part, if we can make a few different changes with things and address the insulin resistance, address the high testosterone, you can go a long, long way with PCOS and healing from it. So we talked about the different symptoms there. So how to heal from it. So we have the high insulin. So the way that we're going to address the high insulin is obviously we're going to reverse the insulin resistance. Another way that we can say that is we're going to increase insulin sensitivity. All that means is your cells are more sensitive to insulin. They're taking insulin in. Remember, guys, insulin, I probably should have mentioned this earlier, insulin is released from your pancreas whenever you have glucose or carbohydrate or sugar intake. And so what happens with insulin resistance generally is you eat too many carbohydrates, you don't have enough protein to really process those things. And every time that you're getting those carbohydrates and sugars, your pancreas is releasing insulin. And over time, that insulin can kind of get higher and higher, and then our cells become resistant to it because it's too high. And so one of the things that obviously helps with reversing this is reducing the insulin. Okay, and we'll talk about, I got a whole slide here, we'll talk about what to do with that. And obviously increasing insulin sensitivity. So reducing how much is there and then increasing like how much your cells are really taking it in, if that makes sense. Things like inflammation, all of those things can cause the pancreas to release more insulin. And so that's where it's like we got to kind of calm down that whole response, but then we got to make sure the cells are taking it in. Now with high testosterone, one of the things we're going to do with this is obviously improving the insulin resistance is going to be huge to even lower the testosterone. But then there's different nutrients like zinc and myo-inositol that we'll talk a little bit about that can really, really help with this high testosterone, getting it down. These are the things that I've seen the most success with in my practice. Again, these aren't the only things. I'm sure there's other docs that have seen, their own different things that work really, really well. But as far as my experience with patients reversing PCOS, these are some of the things that I've seen work super, super well. All right, so let's jump into reversing the insulin resistance. So there's a couple different categories I'll put here. Number one is nutrition. This one's going to be huge. Number two is supplements. If we want to get really specific with things and really try to support the body's intake of the insulin and blood sugar and all those things. And then we have other, which is also extremely important. I would say nutrition, super important, probably number one. I would say others, probably number two, supplements number three. But with nutrition, you want to decrease carbohydrates. You want to focus on 0 to 50 grams of carbohydrates per day, and then you want to increase that protein intake to 75 to 100 grams per day for women, sometimes more, especially if you're working out and things like that. If you have a high stress life or lifestyle, you want to increase that good protein because that's going to help you handle those stress hormones better. You really want to limit the sugars, the drinks, the sweets, the desserts, the carbohydrates, the breads, the pastas, all of those different things, all the things that we love is what I tell patients. So when you look at the protein to carbohydrate ratio, you really want the protein to be kind of like a 2-to-1 ratio or even a little bit more. So what that means is if you're getting, let's say you're getting 50 grams of carbs a day, you should be eating at least 100 grams of protein. Guys, this is just kind of a ratio that I've kind of seen that works well with things, and hopefully that can help you kind of think about, like with each meal, if you're going to have, some good carbohydrates, maybe it's a sweet potato, maybe it's some rice or quinoa, something like that. However many carbs, you want to make sure you're having probably about at least the same amount in protein, if not, double, somewhere in that range. Now, let's jump to other here. So with other, there's different things that you can do through your lifestyle that can help reverse this insulin resistance. And these things are actually going to help increase the insulin sensitivity, which means your body's going to take in the insulin and glucose better and use it. So movement is huge. There's different things. HIIT training, that's high intensity interval training, can be really, really helpful. You can do that with lifting weights. You can do that with walking and running. But essentially what you would do is you would walk for about 2 minutes, and then you would sprint as hard as you can for about 10 seconds. Okay, and then you would walk again for about 2 minutes, and then you sprint as hard as you can for about 10 seconds. You can increase that to sprinting for 20 seconds, 30 seconds, depending on where your level is at with your fitness and so forth. But high intensity interval training, whether you're doing it that way or whether you're doing like weightlifting or some other form, can be extremely helpful at increasing insulin sensitivity. Walking and movement in general is amazing for helping our blood sugar, helping keep things moving, all those things. Strength training can be really helpful. addressing the inflammation. Okay, this is where we kind of have to open up our mind a little bit to think about where could inflammation come from. So if you're eating a lot of processed foods, you're going to have a lot of inflammation. If you're eating foods or eating out at restaurants, you're going to be exposed to these inflammatory seed oils. So in a lot of processed foods and restaurant foods, because they're cooking with it. So that's the vegetable oil, the canola oil, corn oil, sunflower oil, soybean oil, peanut oil. All of those different things are going to lead to more inflammation. And obviously that can give you pain and soreness and things like that. But it can also increase this insulin issue. So that's number one, inflammation. You know, I might even say that, you know, how you think and your thoughts and the words that come out of your mouth can even increase inflammation. If you're always thinking negative things, if you're always talking down to yourself, you're always talking down to other people, that can even increase inflammation, and so forth. Obviously, sugar intake is huge, and so forth. So inflammation is kind of a big topic. Those are some big things that I see is like, what are we eating? How are we thinking? And then all these other things really impact inflammation as well. Stress management. High protein really helps with stress and managing stress. And good sleep as well is obviously going to be big. And then, movement is going to be huge with stress management. But having a high stress lifestyle can increase insulin as well. Quality sleep. You got to make sure you're getting quality sleep. Some people don't get great sleep because they're on their phone at night. They have, maybe their room is like really, really bright. Maybe they have, a lot of disruptions between kids and their spouse and all those different things. Those are things that you can't, some of those things you can control, some of those things you can't control. But one of the things with quality sleep is like if you have a hard time falling asleep, you probably have low GABA. If you have a hard time sleeping through the night, you wake up a lot, you probably have low melatonin, and you need to figure out what your body needs to turn the serotonin into melatonin. And so basically what I'm saying is you have underlying health issues that's impacting your sleep, and you really need to address those in order to help balance some of this insulin out. Fasting can be amazing for increasing insulin sensitivity. One of the things that I encourage with nutrition, and I didn't list it here, but I talk about it a lot, is you want to do 3 meals a day with no snacking in between. You want your meals to be really, really good and high in protein and fats. Those are going to fill you up. That's going to balance your blood sugar, help you handle stress better. And then the carbohydrates you can add in as well. Fasting, though, if you're eating 3 meals a day and you spread them out 4 to 5 hours in between, it's basically like you're fasting a little bit between each meal, which really adds up and really, really helps. Now, if you're going all through the night, 10, 12 hours between your, let's say dinner and breakfast, obviously that's fasting as well. That's really helpful. One of the things I'll encourage people is to do like a 24-hour water fast, maybe once a week or once every couple weeks. You can do 48 hours, you can do 24, 36, 48, you can go up to 72 if you want. You can even do longer than that. I would encourage you to consider that. There's so many benefits to fasting, and so much research that shows how it helps improve the blood sugar issues, helps improve longevity of life, it helps improve digestion, hormones, a number of things. Now, one quick thing that I'll mention is if you are at a place in your cycle where, for example, you're a week or so before your period, you don't want to be fasting during this time because progesterone needs glucose support. So you actually want to eat carbohydrates during that time to support progesterone. I talk about that more with the estrogen dominance topics, but otherwise fasting can be great for women, and obviously men don't have to worry about that so much. Supplement wise for insulin resistance, there's some things that you can really help your body to take in the insulin and increase this blood sugar, taking in the blood sugar. So magnesium is great. The only 2 magnesiums that I really see are helpful with insulin resistance is citrate and glycinate. There's other types of magnesium. There's malate, which I don't see often needed. There's oxide. There's a number of different types of magnesium, but really citrate or glycinate are going to be the ones that you want to focus on. Zinc chelate. Now, there's different types of zinc. They're not all the same, just like magnesium. It's not all the same. But zinc chelate is one of the big ones that I like, and that's actually going to help lower the testosterone, which I'll talk about here in a second. That zinc chelate comes from standard process. chromium, L-carnitine, berberine, alpha-lipoic acid, thiamine, which is B1, and then biotin, which is B7. All of these different things can really help with the insulin resistance. I wouldn't recommend doing them all at once. If you want to try them, these are all very safe. I'd recommend doing maybe 1 or 2 of these different supplements at a time just to see how it helps and things like that. Now in my office, as I'm testing patients that have insulin resistance issues, I'm checking a number of different things on them. We're addressing the inflammation, the infections, we're addressing anything else that's impacting the insulin resistance. But if they need nutritional support, I'm checking all these things and multiple other things to check to see, is their body taking in the glucose and what does it need to do that? When you find the right nutrient, man, it helps significantly, helps quickly, but you also have to figure out why that insulin is high in the first place. Is it a dietary issue? Is it some of the inflammation or stress issues? You have to get to the bottom of those things. So guys, this whole tidbit, this is reversing insulin resistance. Now lowering testosterone, obviously you have to lower the insulin resistance, and that's going to involve everything that we just talked about. Then we have supplemental support. So this is what I've seen work really, really well for my PCOS women. We have zinc, and zinc chelate is what I recommend from Standard Process. There's other types that may be helpful. There's a liquid zinc called aqueous zinc from Biotics Research that can be very helpful as well. That's one that it's a different type of zinc, but it's a liquid. You just let it sit under your tongue and it kind of absorbs that way. And then and that kind of thing. So with the zinc, normally I'll see a higher dosage work pretty well, 30 to 40 milligrams, 3 to 4 times a day. Guys, with zinc, if you take too much, you may get nauseous or you may get a stomach ache and your stomach would be upset. So those are the things to watch out for. Now, I'm always recommending when you're addressing these issues to work with your local functional medicine doctor, your holistic doctor, so that you can have some oversight, and hopefully you're working with somebody that has a lot of experience in all these things and they know how to help balance these things out. Because sometimes doing supplements and trying different things can be helpful, but it can also actually cause things to be worse. So you always want to make sure you're working with your doc and so forth. Myo-inositol is also another good one that I've seen work fairly well. Honestly, I've seen these together in conjunction work best compared to one versus the other, but myo-inositol is great. I'll use ovasitol from Theralogics. You generally want to do 2,000 milligrams 1 to 3 times per day. Kind of depends on your scenario. Doing it once a day can be really helpful, but maybe you need it more than that. Doing it 3 times per day can be great, but maybe it's too much. So you just kind of have to see how you feel and how you do with that. And of course, see what your doctor thinks and what they would recommend for yourself. So other hormonal issues. So guys, this is it with the PCOS. We've got to, I'm going to go back to this slide real quick. We've got to lower the insulin. We've got to address this insulin resistance issue. We've got to fix this high testosterone issue, doing things like addressing the insulin and then improving or increasing that zinc and myo-inositol. All those things I found to work extremely well with lowering this testosterone. And then obviously you address these two things, the PCOS will begin reversing itself. You won't have that heavy bleeding, that excessive hair growth will slow down, if not stop. The balding will stop, that hair will start to come back. Cramping, pain, the infertility, all those things will improve. Now, there's a lot of other different hormonal issues, and I mentioned this before, but estrogen dominance is at the front of all of these things. If you have premenstrual symptoms, okay, so anytime your period comes around that week before or during that period, you have all these different symptoms, the headache, the irritability, the cramping, the pain, all those things. That all comes from what's called estrogen dominance. Endometriosis is an estrogen dominance issue. Infertility is usually an estrogen dominance issue, really revolving around progesterone. Uterine fibroids, breast cysts, all these things are usually estrogen dominance issues. And I'd really encourage you, if you suspect that you have any kind of other condition going on, to really check out the other videos, because estrogen dominance is huge with women and female hormones. And if you can understand how to address those things and address them naturally, you can reverse the premenstrual symptoms. You can have a period where you don't have issues. I know that might sound weird to many women. Usually in practice, when I'm working with women that have a lot of hormonal issues, and I tell them, hey, you can have a period where you don't have crazy amounts of cramping and pain and all these things, they're usually like starstruck and kind of look with confusion, but it is true. Uterine fibroids, you can shrink those and cause them to go away naturally. The cysts in the breast, you can cause those to go away naturally. You have to balance the estrogen dominance, the estrogen, progesterone, and so forth. Infertility, we've had about 100% success rate with infertility in my practice because we address the estrogen dominance, and women are fertile. And then the endometriosis, same thing there. You can reverse that. You've got to address the estrogen dominance and all the different things that can impact that. So, guys, I hope that this video has been helpful for you in learning how to heal from the PCOS. Let's connect. Here's our social media. You can schedule with us. Feel free to reach out, comment, like the video, guys, if you found it to be helpful. I appreciate you guys taking the time to watch this, and check out our other videos. I do this for people that they can learn more about their health and become as healthy as possible, and have the best life possible. So, guys, thanks for tuning in. Check out our other videos. Dr. Joel here. We'll catch you in the next one.